So today we're going to talk about eating disorder, and it's very, very common because food. Why do we eat? Why do we eat?
For nutrition, for survival.
For survival. Yes, I like that. Who said for survival? Yes, yes, you are good, mashallah. So food is very delicious. Don't believe me, ask the dishes. This is written in the Quran. So why do we eat? We said, okay. So here is the lady. Look at this lady, how beautiful and how rewarded she is. Look at her, having her great time by eating this muffin and ice cream and dancing. This is called rewarded. So what is the meaning of rewarded? From the last lectures we said when we eat, the dopamine will increase in the place called the stratum or nucleus accumbens. So stratum is part of the nucleus accumbens, ventral stratum. Increased dopamine here will give us joy and happiness. Okay? Same thing happens when we have intimate relation, when somebody gives us money, when we have new cars. All of that will cause us to have very good result called rewarded. So food is part of the reward system. That means it will increase dopamine in the nucleus accumbens. Let's start with a case. And this case happened 15 years ago. And this is a very important case for you as a girl. Please listen to me. A lady was resident, second year resident, family medicine. Name, we name her Noor. Her name is Noor.
No.
And she has a daughter named Noor. Of course, both names are wrong, but I'm just. So Noor came, Dr. Noor said, Dr. Ali, my daughter, 2 years old, and she is refusing to eat or breastfeed me. I think she has depression. You need to treat her. I look at her. She told me, my daughter Noora, my lovely daughter, I think she has depression. I want to bring her to you because she has depression because she is not eating. Of course, if she has broccoli, I will not eat it. But she said she is refusing to eat and drink with me. So what should I ask her? What do you do? She said, I'm a family medicine president. What do your husband do? She is an eye surgeon. Okay, that's bad. What does that mean? They don't have time to spend with. The daughter is all the time with Shabbat. And the daughter is very upset that her mother is not spending time with her. But the daughter at 2 years old, she cannot tell her mother that I'm mad at you because she doesn't have the linguistic ability to do that. So how did she do that? She reacted by refusing to eat. So food is a way to communicate with people. So if you are mad at someone and he invited you or she invited you to have food with them, if you say no, that's when you don't like them. So Noor is here, is protesting her mother's inability to spend time with her. And then because the mother is busy doing therapy for other people. So in analysis of the case, I told Noor, Dr. Noor, to take 6-week vacation, 6-month vacation, without pay, to spend with her daughter. Why? Because this is the most important point here. If you don't bond with your kids by age of 3, you will never be able to bond with them. Period. So I told Dr. Noor, if you don't bond with her right now, she will grow up and she will never know you. She will have no connection with you. And I have plenty of ladies like this. I have a lady, we call her Ali. Ali is very rich, very nice lady, but she told me when she was 2 years old, she was taken out of the Saudi because she was sick and she was taken to another country to be treated for 1 year. She stayed out with her mother for 1 year. And then she grew up and she told me she is now, Ali is 50 years old and her mother is like 75. And she told me every time I go see her, like I need to go and see my mother and kiss her, and I don't feel anything. Why? Because at age 2, she had this interruption of bonding. So this is very important for you as a girl, not to stay away from your kids when you are a child. Because this is giving her warning sign that I need you in my life. I don't want you to spend all the time in a hospital and spend all of my time with شغالة. And as a doctor, you pay a heavy price for that, so you really need to be careful with that in the future. Okay, so this is another explanation. We said Noor was not able to communicate with her because she doesn't have a frontal lobe. The daughter Noura, so she protests by, not eating or sleeping or dressing with her. So we'll go to eating disorder. So eating disorder is an illness affect. I think it's a lot more than 5% because I think it's like 20% of the population have eating disorder. So let's start with the first one. The first one will be anorexia nervosa, bulimia nervosa. We're going to talk about all three, and we'll talk about ARFID. ARFID is a new thing. I think I put you some slide about it, but I don't think I will bring you a question about it in the exam. So I'll try not to, but read it, please, because it's new. We don't have time. So most eating disorder happen after trauma. Bad childhood. One lady, I'll explain this to you. Trauma is always sexual abuse. So one lady, I told you about this lady who is a marathon runner who had eating disorder. Yeah. And I told her, why you are a marathon runner? She told me, she doesn't know of course, but when she was a child, somebody raped her, and she decided to be a marathon runner because she doesn't want to be, she would want to be fast all the time so nobody can hurt her. So a lot of the patients develop eating disorder to prevent them from being a beautiful lady. Because most of the patients who will be like, we'll talk about this one here, anorexia nervosa. One of the reasons why she is anorexic, this lady, and I have plenty of the patients like her, is one of the reasons, but there's a lot of other reasons, is she doesn't want to develop an effeminate feature because she was raped as a child, and if she grew up to have feminine feature, someone else will rape her, and she doesn't, unconsciously, she doesn't want her. So that's why she is, and can you believe she still feels like she is fat? When you ask her, and I still feel very fat. Believe me, anybody have a glass of water or a bottle of water? Bottle of glass. Yeah, give me a bottle. And this is clearly when she comes to me, to the clinic, I swear to God, she will bring the milk with her, skim milk, and she will open the bottom and skim milk. My lunch. Thank you. Have good lunch. This is how they eat. This is how they count the calories, like 55 calories for lunch, 55 calories. And they still feel, they have distorted feeling of reality, so they feel like they are fat. So the name anorexia nervosa came from the Greek word, and anorexia means loss of appetite because of emotional reason. So what is the emotional reason? Most of them have depression and anxiety, comorbid, I always like. Okay. So cognitive behavior review, they have distorted cognitive behavior. شو يعني distorted? يعني they have fear of being fat despite the fact they are very thin. So they are very fearful to be gaining weight, and some of them can be fear response of having puberty because PTSD where she doesn't want to be raped again. Okay, so what is the criteria? Criteria one is restricted, so they eat very little amount. So you will count the calories and eat 5 beans, 1 ml of milk, skim milk, 2 tiny little slices of bread. So they have restriction of food to stay in shape. What else they have? Criteria B, fear of gaining weight. They are fearful of, I become 35 kilos. Oh my God, I'm devastated, 35 kilos. They need to go below that. So they are scared of gaining weight, and they also have perception difficulty. So they look at the mirror and they look at themselves, and she is very thin, but she looks at herself as very fat. So they have what we call denial or disturbance in the perception of themselves in that regard. And they usually lose their period. So usually you have 3 months of period absence. So in order for us to diagnose anorexia, I will show it to you in a few minutes how we diagnose it. Of course, they have a lot of anxiety and obsessive compulsive and post-traumatic stress. So most of them have all the three: depression, anxiety, cocaine, because cocaine will make you lose weight a lot. So we'll talk about cocaine next week, inshallah. And they have a lot of PTSD, we said. They have eating disorders, sometimes secondary to psychological stress. So last week I had one lady. She was 14 years old, very good in school, normal body weight, but apparently a couple of years ago somebody started bullying the number on her, and she decided that she is fat, and now she doesn't eat at all, and she is so thin that she is about to die from her. So it was the psychological reaction to the event. And most people get this illness after some comment from other people, like somebody will tell her you are fat or you are overweight, and she reacts by devastating herself and start not eating. Right? So there is a three element of anorexia nervosa. First, low body weight. So if your BMI should be below 18. Okay, so the magic word is 18 BMI. Okay, 18. If above 18, it's not anorexia. Second, intense fear. Intense fear of gaining weight. So they have a lot of fear of gaining weight. Third, body dysmorphia. Dysmorphia, yani, not liking what I am. So even though I am skinny, I'm athletic, but I don't like my shape. So they hate their shape because they feel their shape is fat and ugly. What is the consequences? And this will come in the exam, so please look at me carefully and look at me. So first of all, they will have what we call thin bone osteoporosis. Leach. Why they have osteoporosis? They are not eating calcium, they are not eating protein. So they have a lot of fractures. Third, they have no menstrual period for 3 months. So because their hormones go down, estrogen and progesterone go down, so they lose their menstrual. They have cramp, body cramp, abdominal cramp, and they have something very important called lunugo. شو اسمه? Lunugo. It sounds very music word. Lunugo is like a skin, thin hair on the skin because of being very, very thin. And they always have a problem in their stomach, so they have severe constipation. So they have severe constipation. Clear, Yasawaya? And sometimes they have gland problem here. They also have kidney problem because dehydration. They don't get a lot of fluid, so they have dehydration, and their GFR, I think you know GFR more than me, will be very good. Okay? Don't tell me what is GFR because I was 40 years ago, I learned about GFR. They have two kinds. One is a restricted type, and one is what we call it purging type. So a restricted type, they eat only small amount, and that's it. 2 peas, slice of cucumber, slice of tomato, slice of turkey, and that's it. And 2 ml of milk. So they eat very little food, and that's it. And they still think she is fat. So this lady, she thinks she is this. Or they eat like normal people, or eat a lot, and then they compensate by purge. So two kinds, purging type and restricted type. Okay. So, and they have BMI below 18. Most of them will have also substance abuse sometime. Why they have substance abuse? Because most of these model in Victoria's Secret and all of this, of course, I will never look at them, and then I swear I told my life. But most of them use cocaine and stimulant to stay in shape. In fact, they give it to them to stay in shape. Okay. So, anorexia nervosa, unfortunately, is 90% in female Because you know, females are very sensitive about their body features, so they like to stay in shape all the time. Man doesn't care much. And usually start in adolescence. The bad news is the death rate is very high. So death rate is 10 times more likely than any other mental illness. In fact, 60% of them will die, even no matter what you do. Only 40% will recover. So it's very, treatment is very high. They have problems in their family. So all their people, eating disorder equal family dysfunction. Because as we said, food is a way to communicate with people, and when you have bad problems with your parents, then you communicate with them by food. If they are, most of their family are very criticizing. So you are fat, or you are not doing this, or criticism is very bad. Don't ever criticize anyone, ever. Criticism means I hate you. That's not. So the way you deal, especially with anyone, always, you know, like I remember when I applied for residency in America, I swear to God, everybody refused me. I don't know why. So I applied for like 60 places and 59 said no. But they always say very good things like, Dr. Ali, we're really so impressed with your CV. You are so good. You are one of the best. And we are unlucky that we're not going to be able to get you because at this time we had filled all of our positions. And they just like they are crying just because they were unable. So they give you a lot of good things and they say it unfortunately. So always say, if you want to criticize someone, always say good things and then blame it like for example, if I go home and my wife is cooking kabsa or biryani and my wife is very stressful and the kabsa is not that great, so I will always tell her, honey, it's my fault. I think I went to Uganda last week and the chicken there was not very good, but I got it because it was in sale. It's my fault, so always blame the chicken. So you don't you know. So always don't criticize. So this family are very criticizing. Genetic also idolizing thinness. Because the media now show you all of these beautiful ladies, and they really look ugly, but they want to change your perception that being thin means being beautiful, and that's wrong. So this is the media in the 1960s and 80s. In the 60s, beauty means being fat. In the old days, if you look at the beauty in the 60s, being fat is beautiful. After the 60s and 70s, they start shrinking the waist, and Barbie, to be like Barbie, only 1% of the population can be like Barbie because it's impossible to be like Barbie, but they teach small girls to be like Barbie, so when they don't become like Barbie because it's impossible, then they become sad, depressed, and start having eating disorder. So the media changed the whole perception, and they blame the media for all of that now, for all the eating disorder, because this illness was never present in the old time. But we'll go here. So what is the complication? Because the complications can come in the exam, so please read it very well. So one of them is you have weak muscles, right? Because no protein. And diaphragm need muscles. Need to breathe, so a lot of them will die from suffocation because they cannot breathe. Or they have heart weakness. When your heart is weak, what will happen to your extremities? It cannot get the blood out of the extremities, so you have edema in your legs. And you have a bradycardia. What is bradycardia? Slow heart rate. So if you have this in the exam and you don't answer it, you're not going to shoot. So bradycardia, metabolic rate is low, fatigue because you cannot breathe, so you stay home, breathing difficulty, respiratory fatigue, low creatinine, and you don't have any muscles. Muscles is creatinine, and you don't have any creatinine. Bradycardia, so your heart is slow, hypotension, orthostatic hypotension, atrophy in the heart, all of that is symptom of anorexia. What is the treatment? Treatment, we give them 2 medications, SSRIs, fluoxetine, and olanzapine. You know olanzapine?
Yes. It causes obesity.
How it causes obesity? Come with me, bring the napkins. Bring me the napkins, come here. What is your name? مليحة؟ ما شاء الله. Okay. Yeah, please. Let's imagine this is biryani, okay? Or kebsa. What do you like? Kebsa?
Biryani.
I like biryani. It's my meat. So, Maliha is hungry. And I'm the waiter, so you order biryani. This is one dish of biryani. Like you ate the biryani. Alhamdulillah, okay. You are full, isn't it?
Yeah.
If I give you that Rexa, you will say, can I have another serving? Then after, Dr. Ali or waiters Ali, can you have another person? After, oh, another one. Why? Because a signal in her stomach called 5-HTC signal from the stomach to the brain. When you eat one biryani, the signal goes to the brain that Maliha is full, stop eating. When you take Zyprexa, that signal doesn't go. So eating 2 dishes of biryani make you the same as hungry as before. So you keep eating and eating. So Maliha, which is now 50 kilos or 40 kilos, 50 years, in 2 years she will be 150. I swear to God, she will be 150 if she takes Zyprexa. So go back, take your biryani, smell like that. So this is what happened with olanzapine. Olanzapine is a good medication for schizophrenia, for bipolar. But the problem with olanzapine is when it came to the market in 2001, people started gaining weight like crazy, and a lot of psychiatrists got sued by the patient because that medication will make you really fat. Yeah, I have one patient gain 100 kilo on it for 2 years. 100 kilo in 2 years. So it's really, so we give them that, but see, it doesn't work for anorexia. So I give it for anorexia and they will not gain weight. But we try, some people will try. So we give them fluoxetine and olanzapine. Sometimes we give them medication like benzodiazepine and mirtazapine. This also works like olanzapine, but not as dramatic, but it will also help with sleep and help with anxiety. But the main issue in treatment of anorexia is not only the medication, is you need to talk to the family. Please. You don't treat an anorexic patient in your clinic. Don't do that. Okay? You are not experts in treating him. You have to take him inpatient. There is hospital where they stay there for like 2 months, 3 months, 6 months, 2 years. There's places where they stay for 2 years, they teach them how to eat, and they get them away from the family because most of the eating disorder is related to a bad mother or a bad father or a strict family member. Strict, that means you need to be in shape. But let's see, Maliha, if you have la samhallah anorexia and I brought you to the clinic and brought you like 600 dishes of biryani and hummus and falafel and Pepsi, and you start eating, you will die, la samhallah, if you do that. So we call refeeding syndrome. This is very important. So that's why you don't feed them quickly, because if you feed them quickly, they will die. Please.
So do you not use that?
Because of hypophosphatemia. So remember that in the exam. What will happen is when you eat, especially if you use for starvation, then when you have food, it will secrete insulin. Right? Insulin secretion will deplete the body out of the phosphate because metabolism of insulin requires phosphate, magnesium, and potassium. So you will suck all the phosphate in your blood, and then you will have low phosphate. When your low phosphate is dangerously low, what will happen to the heart? It will stop. So most of the death in treatment of anorexia is when you feed them quickly. So you have to feed them very, very, very slowly and monitor their heart and their electrolyte. Yes?
Doctor, can we go back to this?
I can go back. Okay.
If you give them olanzapine, this wouldn't make them feel good about themselves. Then they're gaining weight.
Let's finish in a few minutes. I'll show it to you in a few minutes. Okay. But that's a good question. Remind me if I don't answer it. And this is the mechanism of hypophosphatemia. So most of them, Glucose increase insulin increase metabolism, require more phosphate requirements, cause cardiac fatality. So read it on your own, and remember hypophosphatemia is very dangerous in refeeding syndrome, okay? Because it's not all in the exam, so I want you to understand it very well. But the question now, somebody should ask me, when you eat, you feel happy and rewarded, right? If you now bring me a cheesecake, I will be very happy. You never thought of bringing me a cheesecake. But if you do, I will be very happy. So what is the meaning of very happy means? I have dopamine in my Nicholas accumbens. Hey, it's my striatum. The striatum is like we say Riyadh, and Nicholas accumbens is like Al-Uliya. So it's part of the striatum is called Nicholas accumbens here, which is part of basal ganglia. This is the reward system. We talk about the food addiction. So here, when we eat, we feel pleasure because eating will make me happy, relax, and rewarded. Same as if you bring me a Mercedes tomorrow as a gift, I'll be very happy and I'll have plenty of dopamine here. Okay? But what happened with anorexia? Why? Anorexia patients have the opposite. People suffering from anorexia, look at this here, react differently to dopamine release. So they have dopamine release, but instead of dopamine making them happy, it makes them so they try to eat, but that food will make them scared and make them very anxious. So they have the opposite feeling of normality. The abnormality is what makes me happy, it makes you anxious and obnoxious all the time. So anorexia is, to summarize it, is individual refuse or unable to maintain. Yani they want to eat, they love to eat, but they are scared of eating because eating will make you anxious. Right. Deny the problem, so they still feel I am very, very fat. Third, 3 months no menstruation and BMI below 80. Now we'll move to the second one, is called bulimia. Feminine anorexia. Easy. If you have exam about phosphate, calcium, what else? BMI. So you know all everything, okay? Common treatment, inpatient, وليس outpatient. Medication might not work. Now we give them Zyprexa, but it usually doesn't work. Or else it doesn't work for some reason.
Doctor, in anorexia, is there like a specific time frame in which these symptoms should be there? Like
Well, it usually develops in, see the typical one usually, a teenager, normal teenager, a teenager, something happened, let's see, some bullying, some change environment, somebody, bad mother, bad father, somebody, trauma, then you have the gene of anorexia, and then you start not eating, and then you develop anorexia. This is the typical. So
could it be for like only, for example, a month or 2 months? Or
no, it usually lifelong. So some people will have it for a short period of time, but then recover, but majority will be. Usually those who have it for a short period of time, they will never come to us. They will
yeah,
just.
that's why when you said BMI of 18, like don't certain people would.
Yes, but they don't have the other criteria. So BMI is only one criteria. So you have to have all the 3 criteria. So the 3 criteria is BMI 18, no period. Food will make you, like some people will eat and enjoy food. Those are not anorexic. Or some people will just want to do diet, not out of anything. And I'll show you some other kind now, show you what is the difference. So let's talk about bulimia and then we'll go back to differentiate. So bulimia is revenge hunger, means they are hungry all the time. So most people have severe hunger. They just want to eat. And it could be because low serotonin. They might have low serotonin to begin with. So it's occur in more in female, of course, more in female. Start in adolescent. Majority have depression. Majority of them have depression also. Dental and electrolyte imbalance. We know in a few minutes why. And this is what happened with them. Let's see. Here is not okay. So there is also low serotonin. So what will happen when we have low serotonin? Now, this morning I had very good breakfast. I have baba ganoush and falafel, and Amos look at me, relaxed and happy. It's very hard to make me agitated and nervous, and I don't want to kill myself. Why? Because I have plenty of serotonin. What happened to me if I don't have enough serotonin? I'll be aggressive, I'll be irritable, I will shout at you, and I will show a lot of displeasure in life. Why? Because serotonin is what made me relax. So people with low serotonin, now maybe my serotonin was normal to begin with. Anorexic patient and bulimic patient, they have very low serotonin to begin with. So how I can make my serotonin high? I eat. What serotonin comes from where? From food. Bread, meat, milk, all of them have serotonin in them. So when I have low serotonin, I compensate by eating a lot. What will happen if I have low serotonin? I cannot sleep because serotonin will make me sleep. So maybe this bulimic person have very low serotonin to begin with, and then they start eating to get some serotonin to make them happy. Okay? Well, and they also have something we call enrichment. Enrichment means they are too involved with their family. Yani, there is no boundary between the patient and his mother and his father. They are so, yani, the way they think, the way they act, the way they do anything is like their mothers. They have to ask their mother and their father. They are too involved in their family. They never develop a personality of their own. So those people are vulnerable to have eating disorders. So always try to be independent of your family, have your own thinking, your own pleasure, your own life. My family like kebsa, I will like biryani, just to be different. So don't be like them. Diagnosis is the same diagnosis, bulimia and anorexia, but the difference between the two is what? And BMI. So both of them might eat a lot and purge, both of them. But anorexic have no menstrual period and they have low weight. Bulimic patients have normal menstrual period and their weight might either normal or high. Okay. Let's go here. Bulimia usually have normal body weight and they have to purge at least once a week for 3 months. Then they will have bulimia. And usually what they do is usually first look at A. They start eating a lot, not eating normal. Like you don't eat just one biryani. You eat like 6 biryani and 5 cheesecake and 2 bottles of Pepsi just to enjoy life. Then when you eat all of this, you have sense of lack of control. I cannot control myself. I just want to eat. Then to compensate for that, they misuse laxative, they purge, they fast for 2 days, they run an exercise and vomit. They go through this cycle, 1, A, B, A, B, A, B. They do this for 2 days, they do this for 3 days, and they keep going from A to B, A to B. C, what will happen in C here is they start using all of these laxative, but usually they have to do that to feed the criteria. You have to do it at least twice a week for 3 weeks, or for 3 months upon. And you have, if you have low weight, then you are anorexic. If you have normal weight, then you have bulimia. And this is usually how we diagnose it. I need one of you to differentiate between anorexia and bulimia for me. Anybody can volunteer? Yes, go ahead, stand up. So they have a lot of commonality. They both have family problem. They both have eating problem. But what is the difference in anorexia?
Anorexia, your BMI is
Below
below 18.
18, yes.
And in bulimia, your BMI is either normal or high.
Yes.
And in anorexia, it can be like due to restriction, like you're restricting your diet too much, or you're purging, which like you're vomiting all the food you ate, while in bulimia, you're mainly like purging. And then you compensate by restricting and fasting and exercising.
And both of them can happen after some trauma. Death of loved one, failure in the exam, failure of the lifetime. Good. Thank you. Okay, what else we have here? Okay, here is, and I gave you here the differentiation between them, so please read it in your own. What is the dangers of purging? Purging can have a lot of problems. One of them, what happens when you vomit a lot? Electrolyte will be lost. What is low potassium can do for you? It damages your kidney, it damages your heart, and it causes permanent damage in your stomach. So there is a lot of complication. First, kidney damage, because they also use diuretic, and also diuretic can cause also electrolyte imbalance. Low potassium and low magnesium can affect your heart muscle, so you might have arrhythmia, and some people will die for arrhythmia. And some people, because of lack of electrolyte, you will feel lethargic and tired all the time, so you cannot function normally. They have what we call Russell sign. Russell sign is when you vomit, you use vomiting, you put your hand here so they don't have this sign in their hand. But now they use toothbrush, they discover toothbrush, they use that now. They have very bad smell. What we call it, halitosis, means bad mouth smell, because of the acid in the stomach. They have anemia, they have teeth decay. What else do they have? They might have constipation. They might have stomach ruptures when they vomit, or they have biliary Weiss syndrome, where between the connection between the stomach and esophagus can be damaged. So they can die of many, many complications. But the main difference between anorexia and bulimia is this one. Can anyone explain that to me? Yes.
Basically, that for people with anorexia, that getting that dopamine from eating the food makes them anxious, while people with bulimia, getting the dopamine makes them feel comfortable as normal and happy. But after the happiness, it's more of a regret rather than anxiousness again.
Yes, we know that. But I want to, the type of difference is anorexic patient is very flat, introverted. And if I'm anorexic, look at me, Dr. Ali is anorexic. Eating disorder is very important to know for the exam. Eating disorder is, I will never see anything, flat affect, monotonous voice. They don't have dopamine, they don't have any emotion. Anorexic patient is vivacious. Like, oh, we need to know about eating disorder. Eating disorder is very important. I want to tell you about my story of eating disorder. I was a teenager. See the difference? I'm extrovert. Bulimic are extrovert. I got coffee on the way here today. Wow, I have very good coffee on the way today here. Everybody should have coffee on the way here. Dunkin' Donuts is the best one for coffees. What you call that? Extrovert. Bulimia are extrovert. This is extrovert. This is, they spend most of their time isolated. Treatment for anorexia is also the same treatment for bulimia, and for anorexia are the same treatment. We give them antidepressant, Prozac. We don't give them olanzapine because they already have a very high appetite. Okay. Binge eating disorder is just being fat. That's it. So the same symptom as bulimia, but they don't have compensation. So they don't use laxative, they don't purge, they don't. That's it. Same as bulimia. So they start by eating a lot. They go into binge means they like stay 2 or 3 days without food. They go to open buffet. You see them a lot in this open buffet. And they clean everything in the open buffet. They eat cheese, hamburger. And they feel guilty about what they did, disgusted with the stomach pain. Then they start using compensation, but not purging. They start like dieting and read about it and talk to friends. So they go between A and C. A, eating, then feel guilty about it. In bulimia, they go and vomit it. Here, they don't go and vomit. واضح يا سماعي؟ So they feel loss of control. They cannot control their behavior. Binge eating disorder is really should happen once a week for 3 weeks. So for 3 months. So usually they might have 2-3 days eating normal, then 1 day of the weekend they binge, and then they stay 2 days and they binge a lot. So the same way in DSM-5, except so no compulsory behavior. Right. Why do we eat to begin with? There is a theory that this is important for you girls. Everybody listen to me. Everybody wake up and look at me. Everybody wake up and look at me here. You're going to be a doctor. When I was in America 20 years ago, I was 40 pounds more, 25 kilos more than this. What happened when you become a doctor? Your life is very, very stressful. And when you finish residency, it's even get worse. Very stressful life. All of it. Okay? Unless you're going to go work at Starbucks and make coffee, or Center Point and sell shoes. If you are a doctor, you're going to have a stressful job. You're going to have night where you don't sleep. The way to compensate by stress, the easiest way to compensate stress is what?
Eat.
Food. Because food is, stress will increase your cortisol. Food will increase your dopamine. So there's fight between stress and dopamine. And the problem is when you become a doctor, when you become a doctor in the hospital, the drug company will have a corner where they can go every day bagel, donut, Starbucks, all Starbucks, pizza for lunch, steak for dinner, every day. And if you are stressed out, how are you going to relieve your stress? Eating. So most of the residents gain a lot of weight. Now they put restriction on residents. They stop the company from bringing food. And they give every resident now a membership to the gym. This is very important. I gained all the weight I came. You know, when I went to America, I was skinny like this. My mom used to send me letters. There was no WhatsApp at that time. Oh, my son, I'm worried about your eating, your food, who is cooking for you, and all of that. Then after a few months, I sent her my pictures. And she stopped sending me anything. She said, I'm worried about your study and your social. That's it. So food will be, so the problem is food is primitive coping mechanism. So when we are stressed, we use this mouth to eat. This mouth is our stress relief. And this is in the primal middle brain. So look at here, look at this lady here. She is what you call emotional eater. So you know this emotional eater. When you become deadline, stressed, she need to write CV, and so she broke all of this junk food, because junk food will relieve your stress quicker and has more fat. So stress means most of these patients who have very stressful life, they have a lot of obesity. Right. So here what we see is because the stress will make the nucleus accumbens very sensitive. So when you don't sleep and when you feel stress, you crave, because cortisol will make you crave this. This will become. So this is Mona Lisa, you know Mona Lisa, and this one after she is having a lot of stress. So this is what happened to you. So if you go to residency, take picture like this when you go to residency, and send me your picture in 2 years and make sure you are not like this. واضح يا صباح؟ Yes. Yes, 10% of the people, when they are stressed, they stop eating, but those are the minority. I am not one of them. I am the opposite. Whenever I had bad news, my first stop will be the fridge. Because what happened is, what you asked me, Dr. Ali, we have a frontal lobe that tells us when we eat a lot, when you are stressed, the frontal lobe doesn't work. So we become under the victim of the midbrain. The midbrain wants you to eat. The frontal lobe says stop eating. So when you become stressed out, cortisone will damage your frontal lobe and make you. So we call obesity and addiction failure of the top down of the frontal lobe to control the midbrain. Same as anxiety, same as addiction. Right. Complication of PED, you know it by yourself. Now, afraid, I want you to read it on your own. But final thought about treating of PED. Now we use Ozempic and Mounjaro, you know, all of that, and Vyvanse, all of that there's a lot of medication for obesity now. I take Ozempic, but it's okay. But there is medication before we do that. But what happens, some people do technique, right? Stomach. What will happen to those patients? Anybody can tell me?
Their stomach shrinks.
They can?
They get cancer. I'm not too sure.
No, they don't get
They
cancer.
don't touch again. They get full faster because their stomach shrinks.
Yes. What else?
They can get hypoglycemia.
Mumkin, but I'm talking psychologically. Psychologically, you are very good. Psychologically, what does happen? What was food? Food was my relief, right? So when I get angry and, you know, I tell you a sad story, but forgive me to tell you this sad story. There is a lady who hates her husband. Don't ever hate your husband. She hated her husband a lot. She told me that my husband used to rape me. That's the word she used. She told me after I had an intimate relation with him, I will go and eat 2 pizza, and then I'll feel relaxed. What happened? She became very fat. Then her husband lost interest in her. Then because she became very fat, this is a true story. She had technique, stomach bypass. She became thin. She became attractive again, and she came to me crying. Dr. Ali, what did you do to me? After I lost my weight, he started raping me again. Before, I used to eat pizza to relieve my pain. Now, I have to smoke or use shisha all the time to relieve my pain. So most of the patients who use stomach bypass, they ended up abusing food instead of food, alcohol, benzodiazepine, shisha. I had one lady, I swear to God, she never smoked before. She never had shisha in her life. After the surgery, she smoked shisha 24 hours. So she sleep with the shisha in her mouth. So they compensate, they change food with other substance. So you don't do surgery unless you teach them other ways to cope with obesity than food. Because they used to cope with food by, with stress by eating, and then I'll see you tomorrow, Hank. Arfid, read it. I swear I try not to bring you any question from it, but if I bring you any question, I will try to. I gave you some conclusion and USMLE things, so please read it. And thank you very much for listening to me. I'll see you tomorrow.